All right, Dr. Mark here. I'm here to show you how to place an IV catheter and tape it in. More importantly, is what this video is about, is taping in the catheter and the T-port for certain situations. I have my dog model here. So what I'm going to do is have my catheter, my 3 full thickness pieces of tape, and then I cut one and split it in half for a half thickness piece. So we'll take our catheter and we'll find our vein ultimately and place that in the patient itself. Many times you can pull this out and you have your little stopper there. So I'm going to take a half thickness piece of tape. I'm going to turn it sticky side up. I'm going to come in, I keep my thumb on the catheter itself, and I'm going to put a little pressure towards the dog on that. And then I'm going to wrap this around the dog. And this is going to hold the actual catheter in place there. So the catheter is in. So now what I'm going to do is I'm going to take my T-port, I'm going to take this little cap out, and I'm going to take my T-port and I'm going to place this into the catheter with the tubing going towards the inside of the leg. And that's important. So what I'm going to do now is take a full thickness piece of tape, now that I have my T-port in, and I'm going to go up under the catheter, sticky side down, and put a little pressure, and that also pushes that catheter in towards the patient. And it comes around, and then I'm going to cover the back side of the catheter where it enters the dog with the remaining piece of my tape. So now the catheter is in, it's got a little bit of pressure towards the patient, and it's covered on the back side. So now I move to placing the actual other end of the T-port. You can do this one of two ways. One, you can place this, or your next step would be to take your second half thickness piece of tape and come and put a little stirrup on the T-port to hold it in place with that other half piece. So now we are fully secure. We have the T-port secure, we have the catheter secure, and now we're going to take this component, and this is what I want to talk about, is I would take this and I would place this up high and on the outside of the leg. So you're going to loop this around and put it on the outside of the leg to give you better access. So we're going to take our full thickness piece of tape again, and we're going to place this up above the catheter itself, and we're going to come around. I actually will incorporate the tubing as well, and we're going to place this. So now we have our closing device here. We have our catheter with our T-port T. We have a access point here, and we have our access point here. And so what this does is then allows us to take and put our IV line here, and it's not too low, so it's a little bit higher. Or if you have some sort of device that you're going to add on to this, then you can place this as well, and you can have still access to put your IV line, and you're still not at the level where it's going to hit. So putting this aspect of the T-port up and on the lateral side gives you better access and will give you room to put any kind of device or any kind of IV line in, so it won't go into the ground. But that's placing an IV catheter. You can put vet wrap or whatever you want around it if you do that.